We want to welcome you all into Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers here in Arizona and help you make the best decisions for your family and your life, especially on this upcoming Thanksgiving. I know I've gotten so many questions from viewers on this, and today's numbers were a little bit wild. So we'll put it all in context for you, help you better understand, and help you find the information you're looking for, because we're looking at these websites all day. And if you're not, it's harder to find the info you're trying to find. So just post in the questions and we'll get to the answer for you. November 19th, 2021. I don't know if I mentioned the date. I try to always do that so it's not confusing when it's posted later to YouTube and other places. Garrett Archer alongside me here as always. The numbers today, it got a little concerning, but we'll put that in context. Let's get to that 5,000 number that everybody saw today, which is the number of cases in Arizona.
As we talked about, if you listen to the news at all today or watched it or whatever, you'll notice that the number of new cases reported today are over 5,000. There have been a couple times in the last few weeks that we did report over 5,000, but those were for administrative reasons. There was either the AZDHS, the health department, was either backing up its servers or there was a problem with the tests or something. This is the first one since January 31st, excuse me, that we've had a case report over 5,000. That is just no reason except for the fact that case numbers are being reported at 5,000. And then what that means, of course, is that right now our 7-day average is at, let's see, we are at about 3,700 right now. If we look back to where we were around this time last year, we were at about 3,000. So we're running about 700 cases daily higher than we were during the beginning of the winter surge. They're sort of following each other's patterns as far as the at least the time in which the growth is happening. We're going to show you, I'll demonstrate how the growth this year right now is not anywhere near what we saw in 2020, and we do expect that to continue right now.
Yeah. So we were kind of comparing year to year, obviously, to better understand what's happening here and also how the vaccines play a role in all this. We'll talk about some of those numbers too. One of the numbers that we saw today that we want to just dispel any concerns that might be there was that intubation number. It seems as if it'll be corrected and that it was a typo at some point in the system. But if you look at the full, I think it's the full span of the pandemic, and you see that today's date, there it is, added on. Thank you, Garrett. It shows a dramatic upswing that we shouldn't be concerned about because it sounds like they'll correct it.
Yeah, well, they probably won't correct it because of the way that this dashboard works. But I did reach out to the AZDHS because that obviously looks like a fluke. And, this right here for this day, intubations reported at 184, vastly higher than any other time in the pandemic. And that really screams outlier to me. That there was something wrong. So I reached out to them and said, hey, what's going on with this number? And they said that there was a hospital system that had neglected to report ventilators, and so they just reported all of them at the same time. And so there was a backlog, but because of the way that this particular chart works, that probably wasn't the best idea. That hospital system probably should have just corrected themselves and started reporting the right number. So we're just going to have this big eyesore right here of 184, and we just have to always remember that it's an outlier.
Yeah. Thank you for helping us put that in perspective. Either way, we are seeing inpatient numbers that are up 16% from last week. And that has kind of been true to the numbers week over week as we've started to see this surge. I think the last time we got to meet with everybody on here 2 weeks ago or so, and we could see that that surge was definitely starting then. And those inpatient numbers week over week continue to support that. What are you seeing there?
We're in the midst of, so we obviously, we've already seen the case growth. Let's go to that. We're going to stay with the AZDHS's numbers right now because it's a little easy. And let's go to cases by day. And I'm just going to show you this very briefly. Obviously, we started really growing cases about, let's see, that's about a month ago. But then it really started shooting up about the beginning of November, right? And then as we can see, that's sort of what the curve looked like, this very sharp incline from the last month or so. And what we expect to see is once cases start to rise, about 18 days later or so, we should also begin to see hospitalizations increase. So let me go back to that now. Let's just keep this one in mind where we started to see the numbers grow on the 18th And here's, where the 8th is what the highest number is right now. So let's go back to hospitalizations.
Oh, Isaac's saying we're scaring people. Isaac, we don't want to scare you. We want to inform you.
We want what happens.
We wanted to show you the numbers so that you can make the best decisions for your family. If you're scared, please leave the chat, because we don't want you to be scared. That's the last thing we want you to be. We want you to be informed. So if you're feeling like this isn't informative for you, then it's probably best you go on AZDHS and go through the information yourself.
So you can see that the right now we're looking at the peak of this particular surge. The surge we're having right now, where the peak of hospitalizations is happening right now. At least this is what it looks like. That we expect these numbers to continue, but you can see that really it tracks along with that 18-day mark. Hospitalizations really started to pick up about 18 days ago. And the other one started picking up about a month ago. So if you kind of do the math in your head, we're seeing what we expect to see, an increase in hospitalizations 18 days after cases increase. And so what that means is that as cases increase, we watch these cases increase. And I know people say, well, cases aren't important because, XYZ and younger people aren't impacted by COVID-19 as much, and they're not wrong about that. But we watch the cases because the hospitalizations will trend with the cases. And so when cases begin to slow and to shrink and to fall, then about 18 to 20 days later, we will expect to see hospitalizations to do the exact same thing.
Yeah. Joe's asking, so should everyone stay home and not see their family for the holidays? Joe, that has to be a personal decision for you guys based on the health of the group that's getting together. So if you have people that are immunocompromised or battling cancer or battling things that are listed on the CDC site for a compromised situation for dealing with COVID, then maybe that group, it is best to plan something else. You only know your family the best, and we trust you, obviously, to make those decisions. I'm seeing my family, but we're talking about our vaccination status. So talk to your doctor. They can give you the best information on what you should do. We on this chat, we try to just stick to the numbers and some of the headlines just to help you get started with where to find this stuff so that you can find the best information for Arizona. Garrett, one of the things we just touched on there was the vaccination numbers. Those are also on AZDHS's site. That's probably one of the best places to find them. A lot of people have been curious how we rank when it comes to Arizona versus the rest of the country. We've got more than 60% of the population here vaccinated, but it seems like that trend's a little lower than the U.S. overall.
Yes. We'll look at this site right here, and then we'll go to another site where we can compare the numbers. As we see right here, about 61% of people in Arizona are vaccinated, 65% of eligible. The AZDHS does remove the 0 to 4 age range from that number, and that's why it's 65%. You can see vaccinations have been picking up in recent weeks. We've had 170,000 vaccinations for the week of November 7th, which is the most complete week that we have so far. And when we take that, we follow that line all the way over here, we can see that the last time we had that was on May 16th. That was really when vaccinations really began to drop off in Arizona. As you can see, May 16th, 200,000 vaccination doses on that day. The next one, 137,000. So we are seeing pickups, and they're not just in the under 20 age category. These pickups in vaccinations are occurring. I'm looking at the numbers right now on my internal screen, and we have 4,000 new doses first of all, we had 30,000 doses reported, and this is now pretty regular to see upwards to 30,000 doses being reported, and that has a lot to do with boosters, but we are seeing higher numbers as well for people who are getting either the first or second shot. Almost 10,000, 9,500 people today got their first or second shot. 4,000 of those were under 20, and then 1,800 of those, almost 1,900, were over 65, which is the most vulnerable group to COVID-19. So we are seeing higher numbers of older individuals in Arizona also going back and getting vaccinated, as well as I said, a good, that's about a third of the numbers. So 2/3 of that 30,000 are boosters, and that likely is going pretty much to mostly 65 and older. The FDA did just allow, I think they just recommended everybody
today,
but for the most part, it was today. So for the most part, it's been that 8-month sort of rolling number, and really we're still in that time period where for the most part that's 65 and up.
Yeah, so the FDA, just to highlight that a little bit more, that was one of the biggest headlines today, that the FDA has authorized both Pfizer and Moderna boosters for all adults, so no matter the age group. Now, remember, one thing that's key in this is not kids, so this is not 18 and under.
Mhm.
The only vaccine approved for those 18 and younger is Pfizer. So once again, the FDA has authorized Pfizer and Moderna boosters for those 18 and over. And as Garrett just talked about, that 8 month time frame, even some saying at 6 months, they really start to see it drop off. And it's interesting, Garrett, when you highlighted the numbers in May, because May was sort of that time when it was pre-Delta. People were not as concerned about the Delta virus or didn't see it in their lives just yet, and a lot of the bulk who wanted to get vaccinated had gone out to those mass run, state run distribution sites to get their shot. So it's an interesting dip there before we saw the Delta virus really take off in June. All right. Any other numbers on this specific vaccination page that stand out to you at this point?
Well, but the only thing that really stands out to me is I can tell that these less than 20, because there's so many of those 5 to 11s that are getting vaccinated. That number is moving faster than the others. Only a day or two ago, it was at 20%. Now it's at 23%. So, we're seeing a lot of vaccinations. And of course, AZDHS only gives us this data by less than 20. So we have to look at CDC numbers to get anything. We can actually take that and derive it and get that 5 to 11 number. I did that yesterday for a story for one of our reporters, and right now about 4% of the 5 to 11 population in Arizona is vaccinated, which is considerably smaller than almost all the other states. I think that's number 36 of 51 jurisdictions.
Yeah, interesting. One question that's coming in from Kimberly Rogers that I'd love to get your take on. With FDA approval today for anyone over 18 to get a booster, will AZDHS, their dashboard, start reporting the boosters?
That's a great question. I've asked them this several times, and they don't know yet. I think, the thing with this dashboard is it moves very slowly. If they do start reporting boosters, it's likely going to be probably sometime in January. So
that is slow.
It does move a little slow. And so right now the answer is possibly, but they're looking into it as far as getting boosters, because I'm looking at these numbers saying, based on the numbers we pulled out, we can presume that 2/3 of the vaccinations today are boosters because of the numbers that rose for the 1+ dose. But there's no guarantee that that's the number. That's just what we have to presume, because that's the number
that's all you have with that.
Simply, we're using subtraction. I would always rather to use a data point from the government. That's always a better data point than using subtraction. But sometimes we have to infer using subtraction, which is what we're doing.
Yeah, and I don't think we'd be at the point just yet, if I'm not mistaken, for kids to be able to get their second dose, because if it's 3 weeks beyond approval, and I heard a lot of people talking about that falls right there on Thanksgiving. So all those kids who were looking for that 3-month mark or 3-week mark ended up right there on a holiday, having to go a little bit later to go to their second appointment. Let's see some of the other numbers that we were talking about. I do want to talk about some of these hospitalization numbers, especially because what's going on in New Mexico right now. And Garrett, as I let you pull those up, I'll just bring everybody up to speed on this. New Mexico has 6 hospitals that have already moved over to their crisis standards of care. It's concerning to neighboring states because we will obviously try to help in ways that we can. But if our hospitals are filled, we won't be able to help. And if our hospitals become fuller because people are coming over from neighboring states that don't have enough room, will be fuller. So all things to consider when you're making choices for your family. And let's look at how our numbers are right now and where the biggest concern is in this, Garrett.
Yeah, I think one of the biggest concerns with COVID-19, at least the start of this surge right now, is that the hospital capacity is already showing very low numbers. We have very low numbers of available beds, at least being reported to us by AZDHS. And we're just at the start of the surge. Like I said before, we're probably going to have to endure rising COVID numbers with hospitalizations until sometime in the middle of December. And right now, if we look at these numbers, we have about a 95, you see 6%. So about 95% of our hospitalizations of our hospital beds are being used right now. About 28% of those hospitalizations are COVID-19, which is lower than it was at the, let's go to an all-time here so you can see what it looked like. At all time, when we were at the peak, it was 60% of hospitalizations, and now we're at 28%. If we look at where we were about the same time last year, we are at about 22% of hospitalizations. So already our COVID is taking up more hospitalizations now than it did in the surge. Now, do we expect to get to that peak number in this surge? No, we expect to be about 80% less of the hospitalizations that we got, not 80, excuse me, 20% less than about 80% of the hospitalizations
of what we saw last year.
Of what we saw last year. And we do expect to see that peak probably happen around Christmas. Now, as obviously people will say, well, obviously COVID is not a big deal right now. It's only 28%, but you have to remember that the hospitals have been behind on their surgeries basically since COVID started. If you look at this graph, you can see that there was 20, 30, 40% availability in the beginning, and now they barely struggle to keep it. When COVID was at its lowest point, hospitals struggled to keep availability at around 90% because they had so much of a backlog of elective surgeries. Now, a lot of hospitals have already suspended elective surgeries. And so now, again, another backlog. They'll be facing another backlog after the surge, no matter what.
I was in that exact case last year when we were trying to get in for an elective surgery and trying to time it just right for my child.
Elective surgery is such a bad word for this because people think, oh, it's elective. It's not. These are life-saving surgeries.
Right.
They're just that's the medical terminology of something that doesn't have to be done in the trauma center immediately.
Not in the ER. It's not a race to save someone after trauma.
Yes.
Okay. The city of Phoenix also just decided that they have told its 14,000 employees that they need to be vaccinated by January 18th. That's the date they're putting out. Again, the city of Phoenix, so our largest city here in Arizona, telling its 14,000 employees that they need to be vaccinated by January 18th. At this point, Garrett, they haven't put out the percentage of how many people on their staff are already vaccinated, and whether mandates like this that we're starting to see within the next few weeks, especially in the month of December and January, will have an effect on the numbers. It's hard to tell when you're seeing those 30,000 doses a day. That's still an incredible number.
Yeah, it's hard to tell. It really is. Those kind of variables are so difficult to quantify over time because there's just hundreds of thousands of data points. Obviously, if you think, in something like a pandemic, every single human being that lives in Phoenix or lives in the Phoenix metro is a variable for the pandemic. So it's just so hard to really truly quantify how much of an impact the city of Phoenix vaccine mandate will have on a potential surge in cases. Right now the modeling suggests that the surge in cases will begin to subside in about 15 days or so. At least it will start to slow down. And so, what it might do is help, obviously tamp down an additional surge that happens after that. Or as we've seen with this particular surge, it might be smaller as far as max number of cases we've seen, but it's gone on much longer than the winter surge already, because truly this current surge already, it started on, I want to say June 1st. June 30th is when this current surge truly did start. So we're a long time, and the other surge only lasted about 15 weeks.
Yeah. It looks like Kathy's deleted her comment, so I'll just sort of paraphrase. She was basically accusing us of not talking about, in essence, breakthrough cases. That information is not necessarily out there through the state's website.
Yeah, we don't really have. That's the problem with breakthrough cases, is we don't have the data being a data-driven sort of show we're doing right here, and we're tracking all these numbers. The AZDHS does not publish the breakthrough numbers. We do have, we get snippets from them every once in a while. We do get information from them saying, oh, this is what X month, but we have to ask for it. We have to request it. They're not tracking it on a daily basis. They're running a query and saying, okay, yeah, we know what this is. And so that's one of the reasons we don't talk about it. We do know that breakthrough cases tend to be, I think it's 1 in 5 COVID-19 cases are breakthrough right now. It roughly works out to that, I think. I'm pretty sure it's about 1 in 5.
Yeah, I don't know if Kathy's still here, and I don't know if she deleted her comment or what happened, but basically, we're providing you all the information that we can get so that you can make the best decisions. If there's something that's not coming through us, it's not out there. What numbers we do get, and we try to update them as often as we get them in, is the question of how many unvaccinated people are actually ending up in the ICU. Most of the time, the number is none. I
Yeah.
mean, a couple of times they've said 1 or 2. That's in the entire ICU in huge hospital systems here in Arizona. So, a number that we can get closer to for you is the number of hospitalizations and the number in the ICU. And one thing I want to stress when you're considering this is do you have the funds set aside to pay for an enormous hospital bill? I haven't pulled the numbers in a while, but the last time that we checked, it was $20,000 for an average COVID hospitalization. So it just sort of puts that in perspective on how you'd be able to pay for that or save up for that if your choice is to not get vaccinated. You want to make sure that you have those funds, and that's aside from talking about your health and all of this. All right.
So
You okay,
laughing at a comment. I was just laughing at a comment about, the COVID test is being changed to real COVID test. Like, it's amazing what people have clung onto as far as the sort of the propaganda that has surrounded COVID-19 and what people believe. So it's the COVID test has always been a COVID test. It's never been a flu test. It's never been another type of test. It's always been a COVID test.
Yeah.
Obviously it's changed over time, but it's always, there was never a time where COVID tests and flu tests were the same or whatever.
Yeah.
It doesn't matter. It's always been a COVID test.
You said the F word here, so we'll go there, the flu. You can find all of the flu numbers on AZDHS's site. It's right there for you to look through. There is still flu, and it's listed right there for you. I will caution, if you go back a few years, then you'll have the full report that's in there instead of the raw numbers, which are more difficult for someone who is not a data analyst to read. The full report comes out, I believe, 2 years after each flu season.
And that you actually bring up a good point. I'm just going to bring up something really quick. We did a story this week on excess deaths. I'm not going to spend too much time on this, but the story is on our website. And it's just basically using showing the CDC's numbers, their estimates, and the reported numbers for excess deaths. But, going back to flu, because a lot of people do talk about flu and how, this is just a flu. And there was a time, so this calculation that the CDC does has been around for a long time. I have data going back from 2017. And what's interesting is there was a time, 2017 was actually a very bad flu season. And so these yellow bars are the weekly number of observed deaths, whereas the black line is the number of average expected deaths, what they were expecting to see. And where it's an excess death is when the yellow line goes above the black line. And you can see here in this 2017, this right here was that very bad flu season in 2017. You can see that there were several weeks in January and February where the number of average deaths a week, observed deaths a week, were higher than the number that the CDC had expected. But here's COVID-19. And you can see that basically every single week since March of 2020, the number of observed deaths have been pretty much far exceeded the number of expected deaths. And that's a very important thing to know because it shows that this is not a flu season. And this is not a calculation they just came up with. And it's expected deaths is a very easy calculation to make because states don't change populations very quickly. The demographics pyramid does stay pretty constant. We have about the same amount of heart deaths and cancer deaths every year
after year. Yeah.
And so because of that, they can make these calculations, these predictions, and they're fairly stable. And so you can see COVID-19 does throw a wrench into this number. I know a lot of people like to say COVID-19 and flu deaths are the same. Well, no, they're not. Obviously, there's a tremendous more deaths that they're observing more than they expected to see because of COVID-19.
Absolutely. Okay, let's talk about the projections in all of this. Everybody wants to know, of course, How long is this going to last? I saw somebody post earlier, you're sick of hearing about it. Don't you think they're sick of talking about it?
Oh
Yes,
yeah.
we are. We want
Oh yeah.
COVID to go away.
Oh yeah.
It's not right now. So our mission is just to teach you all where to find this information so that you can find it for your family to make the best decision here in Arizona. I know people are watching from other places as well, and we apologize. We're Arizona-based reporters, so we're focusing on Arizona-based numbers. But oftentimes, you can go take the information we're teaching here and find it in your state. And people have emailed me and said, I watch from Washington State or I watch from wherever, and I model the same sites and then go look on the site that corresponds to, let's say, Washington State, and they're able to find this information. So we're happy to help in that way whenever we can. But the projections, Garrett, and we use this IMHE model that has just been updated, by the way. It's like every week or so, maybe 2 weeks.
It's every 2 weeks or so.
Yeah.
That's when they do it. I saw Kimberly had another question about what did she say? Yes. So is it reasonable to conclude that some excess deaths are due to delayed medical care? Absolutely. That is a reasonable conclusion to make. We will know for certain, with health data, it can take years sometimes for the data to be fully investigated and then published. But yes, that is a reasonable conclusion. There is a number of deaths that are above the COVID-19 reported numbers that are in the excess death numbers. And you can reasonably conclude that some of those are going to be due to delayed medical care.
That's sad.
All right. Going on to the model, as you said, this model has done very well over the past 6 months or so. As I say, every time I use this, I didn't use IHME very early on in this pandemic because it was not trained well enough, and its numbers were just way out of whack of what was actually happening. But now that we have a year of data, these numbers are much, much more in line with what has happened and what will happen, what will likely happen. And so let's start with cumulative deaths right now. The reported number of deaths, 21,000. They do expect to see that in March, we should have a number of about 27,000 COVID deaths. So we're looking at about 6,000. Where are we?
Yeah, right we're going to be at 22,000 next week.
22,000. So this does believe that as far as the reported number of deaths, we're going to be at 27,000. So about 5,000 more deaths by March of 2020 is where they've projected out at this point. If we look at the daily number of deaths, they do believe that the daily number of deaths will peak around Christmas at about 81 to 91 a day, and that's where they think the deaths will line. The hospitalizations will line up about the same here on December 18th or so. They believe that hospitalizations will reach their peak. As I said, about 80% of the hospitalizations that we had during the peak of the winter, which is over here, they believe will be about 80%, which if it's hard to tell now, but as of right now, it does appear that Arizona will have the resources to absorb 80%. But again, that's just based on the numbers. That's not based on staffing or anything else. Daily infections. Here's some good news. You can see right here, this current projection does believe that we're going to hit the peak of velocity, the peak of cases increasing pretty much right after Thanksgiving, and then we should start to see case declines and a little higher than they were in April, May, but still only about 3,100 or so. And this is that is a estimated daily infection, not a reported number, but they think that we're kind of coming up to the peak here very quickly. I don't like to use the mask use one. I think this is not as good, so I just keep with those.
One of the dates on there, and I don't know if you were able to show us, the December 26th date was sadly the highest date for deaths at this point. Isn't that where it hit?
I'm sorry, say that one more time.
That December 26th date. Obviously, I'm highlighting it because it's so close to Christmas, and it would be, you just hate to hear of families experiencing a loss at any time in the year, but especially through the holidays like that.
Yes, we hit in the winter, the things were moving along obviously more aggressively and faster, and we hit the peak of deaths on January 10th. Right now, it does again believe that we're going to hit the peak on December 26th. Now, that is faster than the last projection. The last model that IHME put out did believe that we were going to hit a lower peak of deaths in January. So they have accelerated that number to December 26th. But again, it's still about, it looks like it's about 50% or so of where the peak of deaths occurred in the winter surge.
So I want to be really clear to producer Carrie, please do not pull up this comment on the screen because this will air on TV and I don't want to experience fines or anything else in any other way. But Patty's comment filled with expletives is saying that there's no blanking surge. Garrett, in data analyst terms, can you define what a surge is? Is that when it starts to see an uptick? What is sort of the, how do you define a surge so we can help Patty understand what that means?
If we average out the numbers and we want to see what a surge looks like, it's basically when case growth starts to be in the green. It starts to go positive, and whatever that acceleration is. So
it could be even 1% higher as it starts to. It's an uptick.
Yeah, technically, yeah, but really, the beginning and the end of a surge, of course, are a bit subjective. But this is called a case velocity graph. I'm going to pull up right now, and this kind of shows you where things are. And I'm using this for TV tonight, so it's not very pretty, but because it gets done by somebody else. But this
are you saying your graphics are better?
No, I do the base graphic, and then our graphics director makes it
goes over the top of it. We appreciate you showing it to us early.
So this is the case velocity graph. You can see that dotted line is 0 case growth. That means over a 14-day average, cases are not increasing if the line is below that 0 case growth. You can see that in the 2020 surge on the October the 13th, that's when the 2020 surge really started to pick up, and that we went up to about 60% case growth on a daily basis around 2020. And you can see 2021 has been did not make that. It was actually lower than we were actually slowing during that time. We did go into a surge category around the November 1st. So about 18 days ago or so, that's when we started to surge. But you can see the surge is not moving at the same speed as the 2020 surge. It's actually much less aggressive. And I'm going to pull up one more. I'm going to take this off really quick. I'm going to pull up one more graph. And this is going to be basically the 2020 surge really pulled out all the way, so you can see what sort of to expect on the where we are now, and just see, it'll show you that we're not moving as fast. Cases, and that's one of the reasons why they don't believe that cases are going to be as aggressive as they were in the peak of the winter 2020 season. So let me get this up right here. Here you go. Here's full winter. And now you can see, this is full winter. You can see that the 2020 surge sort of reached its peak velocity of 105% daily growth a day on the 23rd of November. And then it really started to come down until it dropped to under 0. It started to fall on the 27th. Now, remember, anything above this means case growth. Anything below this number means case falling. So the peak was still, the surge was still basically going, but it really lost steam around this area. Now, of course, this is Christmas. There's some reporting issues here, but you can see the peak really was here.
Yeah. Okay. I'm curious. We haven't been able to go to these charts in a while, or if they're still around. Mobility. And I'm asking, how many more people are moving about? Because at least in Arizona, it seems like everybody's out and about. And I ask this because when the argument comes up, well, vaccines don't work, we're in a surge, vaccines don't work. Vaccines in that case would have to be the only variable comparing year to year. And when you've got people moving around and going about business as normal, and I don't know about you guys, do you see people in masks out there? I'm not really seeing many people masked up anymore. You're introducing a lot more variables than just adding a vaccine into the mix to say, this is why. I mean, we've got to have more people out and about than we did last winter.
Yeah, let me see if I can find something. You're right. I haven't really looked at mobility in a while. So I'm going to sort of the old one that I used to go to and see if I can.
While you're pulling that up, I'll just highlight some of the other things that, no worries, that are going around around the country. We always kind of watch what other countries are dealing with so that we can kind of get an idea of what's going on everywhere else. And I'm seeing all your comments right there. Thank you for weighing in. Yeah, Whitney writes, no masking out there. Somebody else writes, not seeing masks at all. Very few masks. Crazy busy everywhere I've been. a lot of people seeing the same things. In fact, I just asked my youngest to put his mask back on more often because of these rising numbers that we're seeing this week. Okay, so Canada has just approved Pfizer for kids. That just went through today. So once again, Canada is joining the US and approving Pfizer vaccines for kids. We've talked about the Russian numbers before, and whether you trust them or don't, they are reporting record high numbers for deaths for their third straight day. So even if you don't totally trust those numbers, what you can see is that it's a record overall. Austria is going back into lockdown. The vaccines there are now going to be mandatory because they're finding no way to get out of this. And I already touched on New Mexico and everything they're dealing with just in the past few minutes. So if you missed that, we've got 6 hospitals going to crisis of standards of care there. The concern, especially for all those who are there, and also being their neighbors next door, whether we will absorb some of the people who need care, who can't get it there. So yeah, Kathy's writing, I'm wearing my mask, seeing other people with masks, maybe half. Really interesting takes on all this. All right, Garrett, back to those mobility numbers. They've got to be having more people out there.
Because I see this all the time, and then we'll go to mobility. People always blaming, there's this subgroup that like to blame the surges on immigration. The numbers don't line up. The correlations don't line up. If you look at when immigration really started to pick up, when immigration or apprehensions on the border, the southern border really began to pick up and sort of reach peaks, we were not having a COVID-19 surge. So there is no correlation between the number of apprehensions or immigration to this country and the COVID-19 numbers. There never has been, and there never will be, and simply because it's just not a large enough number. No matter what you get that number to, no matter how many apprehensions they have a month, it's never going to be enough to, we're talking about a state of 7 million. And that is always going to overwhelm whatever the border numbers are. And there wasn't any correlation last year either when the apprehensions were much lower.
Yeah, thank you for clarifying.
So anyway, okay, restaurant visits. This is from something called COVID Delphi. Let me see. I'll give this to producer Carrie. And then this is the best I can find right now. This group partners and they get anonymous data from cell phone companies to track COVID-19. Again, this data is fully anonymous, but they do. This is their restaurant visits chart for Arizona. You can see that here's the sort of the normal period, and here's the lockdown right here. This is when restaurant visits dropped to very low numbers in the index. And then here we sort of pick up again here to about anywhere from 200 to 300 is in the index. I'm not really sure what the index means, but we're just looking at the trend lines. Mm-hmm. And it does appear that the numbers have slightly picked up from last year at this time, not by a whole lot. So it just sort of looks like we're about the same mobility as we were around this time last year.
Garrett, thank you for taking a peek at that sort of on the fly as well. State to state comparisons are another thing that we sort of spent some time on in the last year to just see how cases were shaking out across the country. I know a lot of people are getting set to travel for Thanksgiving and maybe want to take a peek at how the numbers are, where they're going so they can make appropriate modifications to their travel or their time spent out of the house there. Where can they find the best state to state comparison on, say, cases?
For something that is quite easy for people to digest, I do like the COVID Act Now website for that. I think that it does a very good job of putting out digestible numbers because it also includes vaccination numbers. It sort of puts them on the same front page. You go to that site. Let me go to it really quick. This one is, so they have sort of vaccination numbers. Here you go. It says 69% of the entire U.S. population. You can actually break this number down into counties and see what the vaccination rates look like per county. And then here's the percentages. You can see all the states and see where the states sit. You see Puerto Rico has the highest vaccination rate. Arizona is down here somewhere. Let's see, we're at about 61%. Here we are, 63% at 29. So we're 29th out of 51 or 52. And then we come down here to the risk levels. This is what COVID-19 looks like in this country. You can see right now the southern Arizona states, it looks like their surge is starting to wind down. And then we've got Michigan having very high numbers. New Mexico, as you're saying, having very high numbers. Our numbers are sort of on par with most of the country right now, as far as the gradient that they're using.
So this is covidactnow.org. We just have that address up on the screen for those.
Yeah, and you can look at the stuff by counties too. Yeah, you see, you could go all the way down to county level, and it gives you some really good information. So.
Yeah, so hopefully that helps those of you who are heading out to travel for your Thanksgiving holiday. We'll sort of wrap things up there, Garrett. We will not be here next Friday, obviously. Both
probably not for a while because I'm going back on paternity leave.
Yes, congratulations. It's nice that you're able with our company to split the time up a little bit, so you can help out in different stages of the little guy growing there. So, all right, we will let you know where you can find us if you do have a question on these numbers. Whitney's writing. Thanks, y'all. Thank you, Whitney. Thanks for joining us on here. You can find Garrett at Garrett_Archer on Twitter. I'm also on Twitter at Katie Rammel. That's where you can find me. If Facebook is your preferred method, go to facebook.com/news from Katie. Of course, we've got all our very latest coronavirus reporting, an increased attention to it right now because of this surge that we're in here in Arizona. And our newscasts are on at 4, 5, 6, 9 on CW and 10 p.m. Want to make sure I had them all there for you. And our coronavirus reporting that you may have missed on abc15.com/coronavirus. Kathy's writing, happy Turkey Day. Same to you. Thank you. And I think that sort of wraps it up for us. Again, if you ever have any questions about our coronavirus reporting or specific numbers that we'd be happy to help you find out there, just message us on one of those sites. And we hope that you all have a very, very safe and happy Thanksgiving, and that you are able to at least see a few more friends and family than you did last year. So thank you, Garrett. Bye, everybody.